Hello and welcome to this quick review on protein synthesis inhibitors by Dr. Ignatius Cole. I am Dr. Ignatius Cole. So without further ado, let's go to our review. Now, first, before learning about protein synthesis inhibitors, which are the antibiotics which inhibit protein synthesis in a prokaryotic bacteria, we have to learn about the structure of prokaryotic ribosome. And so, the prokaryotic ribosome consists of two subunits, 50S subunit and the 30S subunit, and it is a 70S structure. Now, to know which of the antibiotics are protein synthesis inhibitors, we have to differentiate them upon which part of the ribosome do they act. So, those acting on the 50S subunit of the ribosome can be remembered by the mnemonic clean, and those which act on the 30S subunit of the ribosome can be remembered by the mnemonic tag. So, clean, tag. So, clean stands for chloramphenicol, clindamycin, linezolid, erythromycin, and azithromycin, which are macrolides. And 30S, the tag. The tag stands for tetracycline and aminoglycosides. So these are the antibiotics which are protein synthesis inhibitors. Now, first let's just briefly review the pathway of protein synthesis. So the thing is, when protein synthesis begins, three structures come together. The ribosome, consisting of larger subunit with its amino acyl site and its P site and its E site. The smaller subunit, the 30S subunit of the ribosome, the mRNA or the messenger RNA, and the transfer RNA or tRNA. These three come together. In the P site, the initiator tRNA binds, and the initiator tRNA has a base pairing just complementary to the AUG codon on the mRNA, and from the AUG starts the protein synthesis. And so this initiator tRNA consists methionine, and this is the only tRNA which binds to the P site initially. Others will bind to the amino acid or the A site, and this is how, and this is called initiation, and this is the initiator complex thus forms. And later the process of elongation occurs, and a new tRNA will bind to the A site, and thus the amino acid will get transferred by the enzyme peptidyl transferase, which is important. The enzyme peptidyl transferase will transfer the amino acid to the tRNA in the A side, and thus the amino acid chain will get elongated. And later, by the process of translocation, each of this tRNA will move one step to the left side. That is, the tRNA on this P site, which is now empty and devoid of any amino acid, will move to the E site, and the another one on the A side, which contains the amino acid chain, will move to the P site, and a new tRNA containing a new amino acid will bind to the A site. Now let's see, where do our drugs act. So to make it easy, I have some mnemonics to remember where our drugs act. The initiator complex is blocked by aminoglycoside and linezolid, and thus the mnemonic halt the initiation. Remember, halt the initiation. And A for aminoglycoside and L for linezolid. For tetracycline, it is much easier. T for tetracycline, T for tRNA. So the tetracycline will prevent the attachment of amino acid tRNA to the A site, or it inhibits the tRNA. So in your question stem, if you see things about the initiator complex and which drug will act on the initiator complex, aminoglycoside and linezolid are the drug you have to go for. If you see the drug that will inhibit the tRNA, go for tetracycline. And the enzyme used for the elongation of amino acid chain, the peptidyl transferase enzyme, which transfers amino acid from a tRNA to another tRNA to elongate the chain, chloramphenicol act on it. So P for P. The only drug from our protein synthesis inhibitor class which has the letter P in it is chloramphenicol. Remember, phenicol as P, P for P, chloramphenicol is peptidyl transferase inhibitor. And to remember that macrolides inhibit translocation, remember macroslides. Macroslides. So it will inhibit the sliding, it will inhibit translocation. Also remember man and lady. Macrolide for man and lady for Linda or Clindamycin. So macrolides and clindamycin have essentially the same mechanism, even though they act on different subunit. No, they act on the same subunit actually. They act on the same subunit. They act on the 50s subunit, and they have the same mechanism. They inhibit the translocation. Now, MCQ. What inhibits the initiation complex formation? The right answer is aminoglycoside. Halt the initiation complex. Aminoglycosides and linezolid. Now let's learn something about the resistance mechanism. So there are not much mnemonic except for aminoglycoside and macrolides. The bacterial resistance to aminoglycoside is caused by acetylation, adenylation, and other phosphorylation or even methylation of the drug. So remember A for A. For resistance to aminoglycoside, it is mediated by acetylation, adenylation, and other phosphorylation, methylation you can add on of the drug. For tetracycline, it is simple. It is a decreased uptake or increased efflux by the plasmid pumps. I don't have any mnemonic for that. Neither for chloramphenicol, which is the resistance mediated by acetyltransferase, and for linezolid, it is by mutation of rRNA. And for macrolides, we remembered M for man and clindamycin alpha lady. So how old is a man? Some may say 18, but I believe it is 23. So resistance mechanism for macrolide is by methylation of 23S RNA binding site. So remember, a man is 23, and so is his lady, that is lindamycin or clindamycin. So 23S subunit of the 50S subunit of RNA is methylated to cause resistance to macrolides. So another question: mechanism of resistance of clindamycin, and the answer is 23S site mutation or methylation of the 23S site of the 50S subunit. 23S site mutation. Lastly, about the side effects. For aminoglycoside, it is nephrotoxicity, ototoxicity, and neuromuscular blockade. I have always found this quite easier to remember. I don't have any mnemonic for that. Nephrotoxicity, ototoxicity, and neuromuscular blockade. These are the only three side effects of aminoglycoside, and all of them are high yield. For tetracycline, you remember that T for T. That is, tetracycline causes teeth discoloration. So teeth has a lot of calcium. So tetracycline causes teeth discoloration by binding to the calcium or chelating the calcium on the teeth. So where else in our body do you find calcium? We found that on the bone. So tetracycline can bind to teeth and it can bind to bone, and it will cause yellowish discoloration of the teeth, and it may also cause yellowish discoloration of the bone, but we don't see the bone. So it will restrict the growth of the bone in children. So tetracycline, you can remember tetracycline by remembering teeth discoloration, and the mechanism of teeth discoloration is chelation of the calcium in the teeth or the hydroxyapatite crystals on the teeth. And where else you find the similar structure? Calcium in the bone, and so you can remember that. Chloramphenicol. So to remember chloramphenicol causes aplastic anemia, you have to remember that a brief history of chloramphenicol. Chloramphenicol was widely used antibiotics for conditions like the typhoid fever and such, but since it caused aplastic anemia, which is irreversible in, it was about 1 in 100,000 people, it is no longer used quite commonly. So remember this, and you can have you can remember aplastic anemia. It also causes gray baby syndrome, but the most important side effect is aplastic anemia, which has quite restricted the use of chloramphenicol. For clindamycin, remember Clostridium difficile associated diarrhea or CDAD. C for clindamycin, C for CDAD. and the macrolides, azithromycin, erythromycin, and clarithromycin. The macronamonic can be used, MACRO. Motility, arrhythmia, cholestasis, RAS, and eosinophilia. Motility, GI motility disorder, diarrhea, it can cause diarrhea, it can cause arrhythmia, it can cause cholestatic hepatitis, it can cause maculopapular rash, and it can cause eosinophilia. For linezolid, I don't have a mnemonic, but the highest yield side effect of linezolid is serotonin syndrome. So remember serotonin syndrome, myelosuppression, and neuropathy. Last MCQ. What is the side effect of clindamycin? And the answer is yep, Clostridium difficile associated diarrhea. A goodbye and have a good day.